Thank you. Thank you, Mr. Chairman, to the ranking member and all the panelists today for this important conversation. I have to say, in Nevada, as of October of this year, roughly 50% of Nevadans eligible for Medicare are enrolled in an MA plan. This is such an important issue for my state. And as we're hearing, of course, we need to better leverage transparency tools across Medicaid programs, including Medicare Advantage. With the enrollment, as we're hearing, and spending growing, I am actually working on legislation that will help policymakers and researchers assess the value of these plans deliver to over 30 million Americans. For today's hearing, though, I do want to focus a little bit on the importance of transparency for consumers. So, Ms. Rieg, I have heard from Nevadans, including in staff in my own state, in my own office, who are trying to help their parents. And they are trying to enroll in Medicare coverage for the first time. They meet with a broker or see an advertisement about Medicare Advantage plans offering $0 premiums and boundless supplemental benefits. It sounds good, sometimes too good to be true. Are advertisements like this misleading? And if they are, what should federal government, what should we be doing about it?
They are, and this has gone on for years. On all of our public presentations and our counseling, we beg the consumers, do not choose your health, your prescription drug coverage based on an advertisement. The advertisements will focus on the zero premium, zero copay at a primary care, maybe no copay for generic medication. But we really want them to look at things like, what is the copay for inpatient hospitalization per day? And when it comes to Medicare Advantage, also know that maximum out-of-pocket, which would be a limit to their financial risk. So the advertisements over the years have gotten more aggressive, and they do focus on those added benefits, specifically cash allowances, debit cards, money to go into the local drugstore and purchase items that aren't covered. And we have counseled numerous individuals, especially over the past open enrollment year. They were very upset with us because we could not use Medicare's Plan Finder tool to order the plans in order of the highest debit card to the lowest. And when we try to circle back to things like their specific providers, mental health needs, and other critically needed services, they really want to focus on those added benefits. And that has been a challenge for us due to the advertisements.
So is there, and I understand the federal government's recent steps to curb deceptive marketing help seniors sign up for Medicare coverage. Is that helping? Can you see some of that?
We are cautiously optimistic. We'll know more as plans go into effect in 2024. Personally, I've seen a bit of a difference in the commercials that are aired on television and the online ads. But there's still, and I get it, consumers with limited incomes, limited resources, to have those added dollars each month for groceries or utilities is a need. But if we can focus on the critical need, which is their health care and their medical needs, it could hopefully redivert them into plans that are best suited.
And would your recommendation of stronger oversight on utilization of special election periods, such as low-income low-income subsidy special enrollment period in the block on enrollments for those with cognitive impairments, would that help if we were to provide more of that oversight in those areas?
Yes, I would agree with that. Thank you, Senator.
Thank you. And then Ms. Hoagland, broker fees. This is an issue for me as well, and it astounds me that this is happening, but I'm not surprised. I am not surprised. Anytime there's an opportunity to make a profit, you're going to see people trying to take advantage of that. I'm very curious, how do the brokers earn these extra incentive payments? And are some of them considered, what we're hearing now, junk fees? I mean, what's going on here?
Yeah, so I would say the add-on fees really do vary significantly, and some, perhaps there could be some value to, an FMO, the middleman we're talking about. They have some, administrative costs, right, to be set up in an ongoing business. But when we hear things like they're being paid for health risk assessments, we don't see a lot of value in having an agent or a broker complete an HRA for or with a member. That's not something that we can get the data and really use it. And so there are more and more of those types of things where we don't see there being true value. It's just what creative way can we come up with to shift more dollars to incent enrollment in certain plans.
So thank you, and I know my time is up, but Mr. Chairman, I think we need to address not just the deceptive marketing, but what we're seeing with the broker fees. The goal here is to make sure this is not as complex for seniors, so they can access it and keep more money in their pockets, and not some other predator who is out there. So thank you.
My colleague, as usual, is way too logical. And heaven forbid, as we talk about these administrative costs, and going back to these Gray Panther days, we always were talking about it. I fail to see how $6 billion in marketing costs in Medicare Advantage is a reasonable allotment for administration. So we're going to work closely with you and look forward to hearing more about your bill.